one of the techniques that became available was called a breath hold technique, or deep inspiration breath holds. You have a woman have her hold her breath, take a deep breath and hold it. The heart moves very well lower to the right and a little bit towards the back in the chest. And when you have a woman take a deep breath, it moves the heart away from the breast, by increasing the separation between the heart and the breast. That enables us to target the breast or the chest wall effectively and reduces the exposure to the heart.
We want to see the area that we're treating without a breath hold and with a breath hold. So they'll have two scans, one with, one without a breath hold. We want to treat the breast with as a little amount of toxicity to the heart as possible.
Prior to a breath hold treatment, the IsoCenter location is imported to Align RT through the selection of the DICOM RT plan. The skin surface of the patient in the breath hold position is defined by the skin contours of the CT scan, which are imported via the DICOM RT struct. These define the reference DICOM surface to be used for alignment and treatment within Align RT. An appropriate region of interest defining the left breast, which is matched to during subsequent surface tracking, is then drawn onto the reference surface. Prior to treatment, the breath hold CT reference surface is selected. The patient is initially aligned manually using lasers and tattoos to the IsoCenter location that was defined during CT simulation. Align RT's real-time deltas feature is then initiated and the patient is coached to take in a deep breath. The therapist will then adjust the treatment couch using the real-time deltas so that the patient is aligned within the preset threshold of all axes, shown by the corresponding green bars. Once the patient is fully aligned, they will be coached to take a breath out. Following setup, the patient is coached to take in another deep breath. As the patient breathes in, as soon as the position of the breast is within the preset thresholds, the radiation beam is enabled automatically through Align RT's gating interface. If the patient breathes out during treatment, the deltas increase towards their preset thresholds and the green bars turn red, and the radiation beam is automatically held. This process is repeated until the full radiation dose has been delivered.
And the fact that there's a machine that literally will automatically go off and stop treating me if I breathe. Because that was my biggest fear at first. It's a real comforting feeling.
I think it's a very crucial part of the breast cancer care for my patients with left-sided breast cancer.